Welcome to the 1% Doctor Podcast. What separates the good from the great, the standard from the extraordinary? It's mindset, it's execution, and it's the relentless pursuit of growth. I'm Adam Lamb. I'm your host. Welcome to the show. Welcome back to the 1% Doctor Podcast. I'm your host, Adam Lamb. Today we have a very interesting guest. Dr. Greenblatt is here today. He's going to share just some amazing wisdom. We're going to talk into just a lot of the research that he's looked into and spent his life in the medicine space on. But without any further ado, Dr. Jim, welcome to the show. Give us a little background on what got you into medicine.
Sure. I mean, from early childhood, watching TV shows, Dr. Kildare, wanted to be a doctor. Came in, thought I was going to cure the world with brown rice and kale in my vegetarian days, and came out as psychopharmacologist, a child psychiatrist. But it wasn't long after practicing, I realized why I went into medicine and really forged a career in the integrative and functional medicine space.
And so where did you start?
I started, in medical school. I was teaching yoga to medical students. I was teaching, we organized integrative. We had chiropractors and we had acupuncturists and people coming to our medical school lectures to educate us on a bigger model for the treatment of medicine. And, my psychiatry career has always shifted between inpatient psychiatry, seeing those with the most devastating illness, and an outpatient practice utilizing nutrition and functional medicine. And I think over the years, been able to merge those kind of interests to really push the envelope a bit on our current model of treating psychiatric illness.
Yeah. How much can you explain to the audience, like our food consumption and things like that affect, I guess, I don't know if it's our psychology or at least what's the word for like maybe some of our behavior or anxiety or stress? Like a lot of that can come from the food that we're consuming. Is that correct?
Yeah, I mean, we've been saying it and our grandparents have been saying it, but now that the research is just clear, we know ultra processed foods affect depression, anxiety, and suicide risk. We understand that we can improve depression by changing a diet. We know that sugar-sweetened beverages can make ADHD worse. I mean, the list is endless, and the research is unequivocal that diet affects behavior. And my world has been in the eating disorder space, so inpatient eating disorders, where we have the most malnourished patients, and they have the highest risk of suicide of any other major psychiatric illness. So it's unequivocal. Malnutrition affects brain function, and how it affects you or me or someone else might be genetically related. We're going to get anxious, we're going to get depressed, but there are very clear connections.
If someone's dealing with what they would consider depression, is there like a, hey, let's check your fridge, or like, is there certain foods, whether it's, I've read studies on, certain dyes that can make kids feel, like these kids get diagnosed with ADHD or some of these things, but a lot of times it's like they switch their breakfast from like, Captain Crunch or Fruit Loops or something like that to like an egg and some toast or an egg and some oatmeal. And then all of a sudden the kid's like a little more, pays better attention at school, a little more calm. Like, how much of that do you think is something that we can just look in our cabinets and our refrigerators? And do you believe in some of those things? Like, is that stuff you see? Tell me a little bit about.
Yeah, absolutely. I mean, as a child psychiatrist, most of my career has been with kids and now more adults, but absolutely diet affects behavior. And we know, particularly for ADHD, more proteins can be better focus and attention. So we have that. And so changing from Captain Crunch to eggs for a week, there'll be some improvement. I think what happens when we get a piece of literature that we like or hold on to, whether it's ultra processed foods or some vitamin, in our medical community, we tend to just kind of obsess and focus on that one thing. And for mental health, mental illness, depression, it's just a little more complicated. So as a functional medicine doc, we're looking at lots of factors, looking at nutritional deficiencies, looking at diet, looking at sleep, looking at the gut. And that's when I can be much more confident we can make a difference without using lots of medication.
Yeah, and I love that you mentioned that because sleep, screen time, like even we know it as adults, right? Like that, give yourself an hour off of screen time before sleep, things like that. Like our kids doing it, right? And is that resulting in some sort of negative outcome that we want to eliminate, right? And so, what are some more things? Let's talk about some other things that you've seen. And I know you mentioned some recent research, like you know, lead us down the path with some more information that you think would be super valuable.
Sure. I just want to come back for a second when you mentioned sleep deprivation. It affects every major mental illness, but the research is also clear that sleep deprivation is one of the major risk factors for completed suicide. So it's just powerful intervention that could be utilized more that's not. And again, that research is clear. But, my world as a nutritional psychiatrist, functional medicine doc, there's been a community of us for 30 years
Mm.
sharing information, clinical pearls. But what's happened over the past few years is an explosion of research, just documenting the effects of both food, diet, and micronutrient deficiencies. And the one I mentioned earlier was this recent study published in Nature from Harvard on this nutrient lithium. But we think of lithium as this drug, lithium carbonate for bipolar, but they were able to establish something we've been saying for 30 years, that lithium is an essential micronutrient. It affects brain function, and deficiencies are risk factors for Alzheimer's and dementia. So we look at utilizing nutritional lithium as a supplement. We use it in kids that are impulsive and aggressive. We use it in adults, and now the literature is quite clear that long-term low-dose lithium is a major tool in the prevention, and they demonstrated the treatment of Alzheimer's.
What do you recommend a certain low dose of lithium, like for someone to start or for someone to kind of test that process? And I know there's a supplement I found that you shared. Talk a little bit about that.
Sure. I mean, I think the world of nutritional lithium, starts as years of research looking at lithium in the water supply. And this is micrograms per liter, affecting rates of suicide, affecting rates of dementia and Alzheimer's. So it's very tiny amounts that we need. And so my recommendation is around 2 milligrams a day for most people for prevention. Sometimes we go higher if we're treating some underlying mood disorder. But I think on the internet, people are taking 10, 20, 30 milligrams of this nutrient lithium, and we just don't know what the effects are of these higher dosages. Now, lithium carbonate as a medication has profound implications for bipolar disorder, but that's treating a major psychiatric illness. And we know if you take it too long, you'll have side effects, usually kidney damage or thyroid damage. So my work is focused on low dose nutritional lithium close to a physiological dose. And that's around that 2 milligram.
What's the dose that someone takes for the lithium bicarbonate for bipolar, for example? Like what would be an example dose?
That could be anywhere from 900 to 1800 milligrams of lithium carbonate to stabilize somebody who's bipolar. And many psychiatrists keep people on these high doses to prevent relapse. I think our work has demonstrated that over time, you can use lower dosages to prevent these side effects.
And so you're saying for kind of that average person who, what are some of the symptoms you think that someone would connect with where they may think, hey, you know what, I should give some of this 2 milligram lithium dose and give it a try, right? What would be some of the key indicators that someone might say, oh, that's me?
Yeah, I mean, the 2 milligram dose to me is kind of a preventative, essential micronutrient, preventative dementia and cognitive decline. For individuals that are symptomatic, and the two symptoms that are most responsive to nutritional lithium is irritability and impulsivity. And that's where we might start at 2 milligrams and titrate up to 5, maybe 10. Individuals that are struggling to stay off, addictive substances, whether it's caffeine, gambling, or alcohol. Individuals with family histories of addiction or poor impulse control. Sometimes those individuals go 2 to 10 milligrams, but kind of the starting dose is always two, and the preventative dose, I believe, is closer to the 2 milligram range.
So, and I know like you and I talked about this almost like if you find yourself getting mad quick or triggered quick, like something like a reactive responsive nature about yourself, that potentially this lower dose, this 2 to 5 milligram daily dose could prevent that or slow that down or like is that align with what you're saying?
Yeah, absolutely. Think of irritability, impulsivity. Impulsivity could be making a financial decision. It could be, hitting somebody that you didn't want to, a kid, or just the emotions, not being able to inhibit that emotions. We all get angry, but some people can't inhibit that. And that all is related to how lithium works in the brain.
Yeah, I think, for me, I think of different situations. Like one of my worst places is the gym. And it's this competitive nature in me. Like when I go into the gym, it's like I'm going into the arena to fight. And so I always joke, you don't want to meet me at the gym. Because if I meet you at the gym, I have to like come down out of this like fight state, right? Like I'm in there like lifting heavy weights and I like there's this aggressive nature, this competitive nature. And I know other athletes that connect to this. And and so like if I'm in, I remember a couple weeks ago I was at the gym and this young man like asked me a question. I think I had like a Jesus shirt on, and he was kind of like, "Are you a Christian?" I was like, "Yeah, why?" Like I'm just not who I would use, how I usually would be if I were like at church, for example. But but and so there's like some of that stuff, and I notice about myself where I can even be more judgmental, right? Or just like it's like your flight's delayed, and like you just you might just be crabbier, like just less likely to be as nice. Like I don't know if it can help in those behaviors. I've always had somewhat of I call it more obsessive than addictive behavior, like where I'm all in. I don't do anything a little bit. And so, that's why this conversation was always interesting to me. And this like low dose lithium, is there a potentially, does it mean maybe there's a lithium deficiency, or does just about everybody have some sort of lithium deficiency? I mean, talk about that a little bit.
Yeah, I mean, I think what this new research over the past year has demonstrated is that lithium is an essential nutrient. And like every essential nutrient, we all have varying requirements, right? Not everyone needs the same amount of vitamin D to obtain that optimal level. And so I learned early in my career, actually before I was a psychiatrist, from Jonathan Wright, that yeah, there's a lithium deficiency syndrome. Those are individuals that have some of the symptoms we're talking about: addiction, aggression, impulse control problem. So those individuals might not be able to get sufficient lithium from their food and their diet and might need supplemental lithium. So the research has not documented a lithium deficiency syndrome, but if we, don't feed animals lithium, they have lots of medical problems. They can't reproduce. And what we have found is that those without that family history and that constellation of symptoms just respond to that higher dose. So I believe there is such a thing as a lithium deficiency syndrome based on genetics.
It's interesting, and I think like magnesium is one I think of that we're just about all deficient magnesium just due to diet, nutrition, and some of those things, and all the great function that magnesium has in our body. And so the lithium discussion is interesting, and I think you're right. You can we can just zoom out and look at society. And when we talk about some of the what you'd say is maybe symptoms of potential lithium deficiency, we see a heightened amount, probably more in society than we've seen before. Do you think that that's something? Do you kind of believe in that, or talk a little bit about that if you're aligned with that message
Yeah,
as well?
I agree with you. Actually, magnesium is probably the most common micronutrient deficiency we see in psychiatry, or I see. If you look, it helps tremendously. And as stress goes up, magnesium goes down. But again, research just this year demonstrated that diets and ultra processed foods caused a lower absorption of lithium. So less lithium in the diet. So absolutely. Um, our current lifestyle and diet probably is minimizing the amount of lithium we're getting, and it's probably affecting some of the behaviors and increase in psychiatric illness that is just too common.
That's interesting. So what would be some ideas that you would have to share for people that kind of want to walk away from this conversation? They might be thinking, hey, maybe I have a lithium deficiency. What are some clear signs and triggers that it could be? Also on the psychiatry side, like, is there something along the lines of that, seeking somebody like you for help or assistance? What are some things you would share that someone listening could think about for themselves?
Yeah, I mean, I would just start reading about lithium orotate. But obviously, if you're somewhere on the web, be cautious and try to go to reputable sources on our educational platform, Psychiatry Defined. We have courses and webinars and conferences, a 2-day conference from speakers from around the globe on lithium. So read about lithium, understand lithium orotate, and I think the most important clinical symptoms would be that family history. If you have a family history of addiction, aggression, or bipolar disorder, then maybe you or your children would benefit from low dose lithium. And I think now, over the past 5 years, the functional and integrative medical community is much more aware of nutritional lithium. So I think there are many clinicians who understand how to use a nutritional lithium. Just caution, don't be too aggressive on the higher dosages. Start with the low dosages and titrate up only if needed.
What would be a sign that you maybe titrated too high?
The good news is I see very few side effects to lithium. In animal studies, they got too tired and sedated. And I had one doctor I was treating who told me she just felt too calm. Many of us are used to being busy, energetic, and having 20 conversations in our head and multitasking. And maybe lithium will calm things down and it feels different. The side effects I've had to these low dosages are headaches and feeling too calm. And that's pretty much it. I mean, there are clearly side effects to lithium carbonate, the medication that you need to be cautious of.
This is, and so to be clear, is lithium bicarbonate, which is typically prescribed high dose to treat bipolar. And then there's lithium orotate, which is what you're describing as low dose lithium. And you can buy that as a supplement, correct?
Correct. It's over the counter. And then not many companies have the 1 milligram. So you want to start with the 1 milligram pill and titrate up if needed.
Yeah, there's a book I read. I'm actually going to pull it up right now. It's called Driven by, I don't know if you've ever heard of it, by Douglas Brackman. He's a PhD. And it's about this genetically, and it's a lot of like Navy SEALs have it, pro athletes, entrepreneurs. I have it, which it interests me, but it talked about a lot of that genetically having that. It's like almost an obsessive mindset behavior towards good can be great. You can go build great companies. Be a Navy SEAL. You can, be a top pro athlete. But on a destructive side, it can lead to addiction, compulsive behavior, and some of these other things, which I struggle. I just shared Friday was 9 years I quit drinking alcohol because it was something, I got an obsessive behavior. Like I don't do anything a little bit. So going out and having a beer was like, why are we doing that? Like let's go out and have 7 or 8 drinks. That's way more fun. But it's also that part of part of like, it creates risk, it creates uncertainty, if there's like some of those, which has helped me build businesses, on the positive side, removing alcohol as a potential impulsive, obsessive behavior going into business. Now you said sign running for office here. Like I love to go all in. I love those kind of challenges. I love chasing those things down. And, but I think too often, many of us genetically and don't know it because maybe we come from a family of addiction and we end up going down a path that's maybe obsessive or impulsive to that behavior that's going to lead us to turmoil versus something great. Talk a little bit about what that, if have you seen some of do you know what the genetic, the SNPs are? What have you seen any of that stuff from the study?
Well, I mean, I think there are now, we've gone quite, excessive in looking at genetic profiles. And there are companies looking at 1,000 genes, and there are a number of genes that have to do with kind of behavior and drive. I think, over the years, some people have simplified it. But these genes have to do with how you metabolize neurotransmitters, particularly dopamine, and how you absorb micronutrients. And I think lithium is probably the least studied, but I think it's part of that complex. So, absolutely, there's these tremendous genetic vulnerabilities to either requiring more dopamine or breaking it down to more quickly than someone else, which means you got to do the next thing. So those are part of our what's called a functional psychiatry workup. We want to understand the genetic vulnerabilities. We want to help an individual kind of guide that balance between their genes and their environment. And you're absolutely right. There are some environments where your genes are going to just make it really easy. But think of a child with ADHD and in a school setting having to sit there for 8 hours. That's just not a good gene environmental match. So
And
that's
we talk about the processed foods and inflammatory foods and potentially foods that we have an issue with. Some of the stuff I've read too, of like you have those kids with ADHD behavior, but some of it can just be inflammation going on in their body and they don't know how to express it. Right. It's like when I was joking the term like feeling bloated. Like my version of what feeling bloated might be in my wife's, like she might feel gassy, but a woman's typically not going to say, I feel like I got a lot of gas, right? Like where a guy might be like, I'm like, oh man, bro, I feel gas, but I might say bloated. If I feel bloated, I feel like I'm retaining water because maybe I've had too much salt or like something like that. And so I say that as even adults, we struggle sometimes to explain how we're feeling. We're children, they don't even know. They don't know what inflammation is. They don't know. And so, but that can respond in a behavior of that he's restless. He's speaks out to like, it's like if you have to go to the bathroom, right? You're kind of jumpy and you're standing, you can tell when a little kid has to go to the bathroom sometimes because they're moving around, right? Anxiously. And so I think sometimes that the foods and things like that we consume that may not be serving us can create that environment as well. So I love that you talk about that versus just, hey, give this kid a pill so he shuts up and chills out versus like, let's take a look at what the child's consuming and think if what they're consuming is leading them to a certain behavior that might be unsettling to the people around them, but it's probably very unsettling to the individual child. Do you work with folks on kind of discovering some of those things?
Sure. I mean, food allergies, particularly for young kids, these children under 7, which are, and a recent article came out, they're being placed on 2 and 3 medications, these 6, 7-year-old kids with behavior problems. And most of the time, we're finding those are environmental sensitivities, food allergies. So it could be a healthy food, it could be tomatoes, but that person has a immunological response and can have behavior problems related to that called delayed hypersensitivity. So, yeah, healthy diet is one thing, but there are some individuals that might be sensitive. We call them food sensitivities, healthy foods that can cause inflammation and ultimately behavior problems. So testing is critical to understand that because as you said, the kids aren't going to express what they need to help you understand what's going on.
Yeah, I was one of those kids. And so like that's kind of, had a heart for that of, children, you can be misunderstood and the behavior gets categorized, especially today. Um, but then, you zoom out at like, that's why I think like why I quit alcohol. My dad had an alcohol issue, drank, and I mean, basically killed him, destroyed his frontal lobe, had early onset alcohol dementia. Both grandfathers had to quit alcohol. Like my uncle had, like my brother quit alcohol. Like everybody, there's an issue. And so for me, I was like, all right, I'm just pulling that variable out. It didn't lead to positive behavior or positive outcomes. And so I think there's a spending, time looking at familial history and understanding some stuff about genetics. Now, at the same time, not putting yourself in a box, right? Saying like, I think there's that saying about the alcoholic father with 2 sons. One chose to not drink because he didn't want to be like his dad. The other one chose to drink because he was just like his dad. Right. And so it's interesting from the psychology standpoint. I'm sure you deal with a lot of those things, but then also us being able to stop and understand that there's some chemical or supplement or nutrient deficiencies that can also be exasperating or really opening up the door to problems in this area. What anyone that, is listening, what would you advise? Is there like, hey, maybe go get a food allergy test, look at familial history and say, hey, is there a lot of compulsive behavior maybe? And that could be a good sign. Is there a test for lithium too? I mean, I guess that's the other thing we haven't talked about. Is there a blood level that someone should have potentially, or has that not really been studied enough yet?
Yeah, there's no blood tests, because the blood tests are only looking at the prescription medications in the blood. What is available, and sometimes we look at, is a hair test. So we can look at levels of lithium in the hair. And in the old days, I used to maybe see 50 or less percent of the practice had undetectable lithium, and we could say lithium deficiency. Now it's even higher for whatever reason. So a trace mineral, a hair test is one way of assessing lithium. But I think there are just some routine standard labs, vitamin D, B12, iron, magnesium, thyroid, that are just have profound implications for mental health that are just not being looked at by primary care doctors, and certainly not being looked at by psychiatrists. So my recommendation is just getting a medical workup. And if someone wants to dig deeper and avoid medications, then seeing a functional psychiatrist who can look at food allergies, can look at levels of amino acids and fatty acids, to really dig deeper and develop a more personalized nutritional approach. And that genetic test can be an important part of it.
I love that. I agree. I think that's super, super valuable information, and that a lot of people can, take action. I think with even my kids, like my daughter's 12, my son's 17, but he like and he actually brought it up, I think last week. He was like, should I get blood work again soon, Dad? Because like my kids, I'm teaching them, like, we check blood work, right? We just make sure, see where things are at, especially as their bodies progress. Too often in society, I think we don't do regular checkups or blood work, and we wait till there's a problem. The spot shows up, the stool changes, the urine, like something, the symptoms show up, and then we're checking blood versus finding out what's it, everything's good. Great. Let's see what great looks like, right? We've done that for years. I've spent a lot of time in the hormone optimization side. We started working with young people early too, especially athletes, so they could see, like, what is, if you're an all-star college athlete and everything is functioning perfect, what does that actually look like? Because, when you think of some of these, we call them, he's a genetic freak or some of these things. Well, yeah, their genetics might be a little bit different. Their blood levels might be a little bit different than the average person potentially. What's that look like? So that if we look at it later when there's a problem and we're like, wow, everything looks normal. Well, it might be normal for society, but it may not be normal for that individual. And then we can start looking at different things that could correct it, or things that are causing the decline in that functionality. And so I love that you shared that. I totally agree with you in all those areas. And this has been super informative. What would be the best way, if people are interested, to find out more about you, like where they could find you, or maybe some of your research and some of these things, and look into like lithium orotate, share a little information about yourself?
Sure. I have an educational platform for clinicians on psychiatryredefined.org. And then my website, where my books, I have a book on lithium and a new book coming out on depression, is jamesgreenblattmd.com. And we are always providing educational webinars, conferences, on the field of integrative and functional psychiatry.
I love that. I thank you. And I appreciate so much of what you do. Again, I think too often in society, we want to just say, take the pill and shut up. And you're actually turning over the rocks to look underneath, to see some different areas that could be causing the problem, versus just taking a pill to mask it. And not knocking that, some medication is great and some people definitely need it. But I think as we dive deeper, we can find out whether it's different dosing or different solutions or some other things that are causing those problems. So I commend you for the looking at the functional side of that, because I don't think enough people are. And I thank you so much for being on the show. This is very valuable. Every time I talk to you, I learn so much, and inspired that there's a lot of people like you, not only doing this, but like you mentioned, you're teaching other docs how to do this. And that's fantastic. And I hope there's more opportunity for us to work together to help spread your message to more docs so that they can help more people. I believe that that's how we're called to impact those lives. So thank you again for being on the show. I appreciate it. You're a wealth of knowledge. My name's Adam Lamb. I'm the host of the 1% Doctor podcast. Thank you all for tuning in. Please like, subscribe, and share, and tune in to all the future episodes of the 1% Doctor podcast. Thanks so much for tuning in to this episode of the 1% Doctor. Please be sure to subscribe to the show where you're able to consume more podcasts, get more value, and learn more about doctors potentially just like you. Please tell a friend, review the show, and we'll see you in the next episode.